Hey everyone, Gavin here from Chinese Medicine Education and China Book Sydney. Today I'm joined by Dr. Edward Neal. Now, in the last 2 years, I've just completed training with Dr. Neal. I'm going into the Neijing and studying his Neijing Nature Based Medicine. And so I just wanted to bring him on for a bit of a chat to get him to share some wisdom and share some of that because I know your stuff, Ed, isn't as well known particularly in Australia. So I just wanted to help raise a little bit of awareness of that because I think what you bring to the industry is really beneficial. And I know, like for myself, to give a little bit of background, the 2 years learning has definitely changed my practice. It's changed the way I think about things, and it's definitely helped me sort of bring a renewed kind of passion to what I do. But not only that, in terms of practice, it's also been very beneficial to like my personal life. I've had a lot of change, like good change, but big change happen in the last 2 years. And it's kind of been like a bit of a guiding light, and it's helped me kind of work through some of those things. So I really appreciate like what you teach, and thank you for all of that. And thank you for taking the time to have a chat today. So welcome.
Thanks. My pleasure, Kevin.
All right. So, for those who aren't familiar with you and your work, would you be able to give us a little bit of a sort of um, rundown of your journey into medicine and then how you've sort of navigated your way to eventually be like practicing and teaching what you call Neijing Nature Based Medicine, and also a little bit more background on like what's behind that name, like why Neijing Nature Based Medicine?
Sure. Yeah, I'm trained as a Western physician. I was an internist, worked in the hospital in the emergency room, and was going to be a surgical intensive care unit academic researcher. That was my professional path. And I took some time off to do primary care, and I became interested in what I could do for the patients for whom Western medicine was not working. And I was working at a refugee health clinic and started to use different approaches, and Chinese medicine was one we had some support for, and I got very interested in it and went off to study. Finished TCM training. I mostly studied with Dr. Anita Cinolini, who is an Italian physician, and she's my main teacher. And as I was studying and traveling to China, it became clear that the people whom I respected who were working in the field all studied the classics. And so it was one thing I knew I had to go there. And so I began to study, went back to university, studied Chinese, started working full-time in Chinese medicine for about a decade, then got very interested in translating originally for my own interest about the Neijing, started to do it. And then something happened right when I was beginning, which was the early Chinese texts were all put on databases, accessible databases, searchable databases. And this really changed the way I could study them. So in the past, you'd study with a teacher, read the book, try and read commentaries. But now there was this database, and you could take characters, for example, put them in the database, see where they were located in the Neijing in every instance, not only the Neijing, but all early Chinese texts, translate all of those instances, and then start to build a new understanding of the meaning of the character, and then go back in and use the new meaning to retranslate the texts. So that's what I got very interested in, and that really opened up a whole wealth of information. And I started to teach it to students, and I've been doing that for 15, 20 years now, and now it's the class we have. About 2019, I realized that we needed to change the name from Neijing medicine to something else because, first of all, there are many people who've studied the Neijing, and we want to give space for all teachers and opinions and people working in the field and not just say we're teaching Neijing medicine, quote unquote. And so I wanted to give it a name that also respected where it came from, and the people who wrote the book, the ancestors, were studying nature, and it came from the Neijing text, which is what they compiled. So Neijing Nature Based Medicine. And that means that there are different approaches to it. I don't know if you know that the early Chinese language is very ambiguous and open and free and open to many different meanings. And that is kind of the definition of a classic, say, of literature and art too. One of the qualities of that is that you can look at it again and again and see different things, and different people see different things. So we wanted to give space to that, but also describe what we were doing. Yeah.
Great. And so, um, I understand the work that you've done with translation. You've kind of actually created a whole system around that. You call it classical text archaeology, and that's been like a really big thing. And it kind of seems like it allows, when you start to use that method, it allows like a practitioner to start to dive into the classical texts and start to get an understanding for themselves without necessarily needing to be part of like a big lineage or having special insider information. You can start getting your own understanding from the classics. And I wanted to get your perspective. Is it something, because a lot of people may or may not have the time or the inclination to really get into translation work or like studying classical Chinese, is that a sort of approach still something that somebody who doesn't have a good grasp on Chinese can get benefit from? Can you just elaborate a little bit more on that?
Yeah. Classical text archaeology, first of all, that is a term that's already in use by archaeologists. So, for example, if you're in a dig in Egypt, there will be the person who's the classical text archaeologist who's like interpreting the hieroglyphs and so forth. But I wanted to use the same term for what we were doing, and it's slightly different because we have now a formal approach to looking at text. So when I was first translating, you start reading, you don't really understand what they're saying, it's all confusing, how to put it together. And I realized there needed to be a kind of a formal way. So it's not just my feelings or intuition about what they're saying, but there's kind of a formal way of approaching things. And so I started to develop this idea of classical text archaeology. And the basic idea of that is that the text is an archaeological site. So just like any other site where you're kind of digging things up and finding things, and you approach it with an open mind, not with an understanding of what it is. It shows itself to you, right? So the same with the Neijing text. So if we are looking at a character like Qi or Yin and Yang, we're going to treat it like an archaeological fragment, like a pot or a drawing or something like that. We're going to take it out, try to organize it, so forth, and try to study it. And we study it by looking in the rest of the text database where we find that character, looking at the passages, translating them. And then there's a series of validation steps that are used too, like does it fit the meanings of the times and the culture, in general. One of the validation steps for us is, can you find it in nature? And if we make a translation, you can't find it in nature, it's very doubtful it's true, Another validation step is, does it lead to significantly better outcomes in the clinic? Like not just a little bit, but a lot better. If you got it right, it usually does. And so forth and so forth. And that understanding is translated into something we call Neijing Nature Based Medicine. So the Neijing text is one thing, that's the writing. The work, classical text archaeology, is another, that's the kind of formal interpretation we use. And then the healthcare practice that we use is called Neijing Nature Based Medicine. For example, in Neijing Nature Based Medicine, there's the idea that the body is a coherence of breath and light. And that all comes from passages in the Neijing, that it's not a car with parts so much, but it's actually a resonance or a coherence of breath and light. And that all human illnesses start with an impairment of that breath and light, that form of breath and light. And it seems that there are only 7 causes for that. So we teach that there's 7 causes of illness, and they lead to obstruction patterns in that tensegrity of breath and light. Now, if you go into the Neijing text, you're not going to find anywhere that there's 7 causes of illness and the body's a biotensegrity of breath and, so forth and so forth. But that all comes from direct passages in the Neijing. So it's a kind of an aggregate so that we can put it into practice, because over centuries, many people have read the Neijing, but the real challenge is like, how do you put it into practice to treat multiple sclerosis? That's where kind of it falls short for a lot of people. And so this is that last step, which means we're actually going to put it into use. When people are studying the classics, there's 2 real ways to do that, in my experience. One is to go to China, go to university, study Chinese for 5 years, start practicing translating classical texts and so forth. The other is to study with someone who's done that and to look at the lines together, the characters, and have a conversation. reading a translation on your own is not a way that usually brings great results. Now, I have to say, this has all just recently changed quite a bit because of AI. And AI actually does not a bad job in translating the classics. It's not perfect, it has mistakes. Although I say, like in the Wu Yun Liu Chi's parts, which are some of the more esoteric, where they talk about the interactions of heaven and earth, it's the one place I've seen AI kind of break and go into loops and say, I don't understand this, I don't understand this, I don't understand this. Like HAL, the computer, 2001. But anyway, because now, like, you could put the Neijing in an AI script and have it translated in, 10 minutes. It's done. And it ain't bad. So we're actually, with our students, we're letting them use the AI. Of course, they can do it anyway, but, just as a way of playing around in the field, a bit. And it's very interesting and it's been helpful. So that's what I would say. So a lot of people go to Chinese medicine school. Maybe they have a class at the Neijing, Shanghai, then they buy the book, unshouled or whatever. And then they kind of read it and then they put it down. It's on their bookshelf and it doesn't really influence them that much. So I guess those are the two ways I would say it. I don't think classical text archaeology itself is something you could do just off the bat. That would mean but you can play with it now. And actually the students are doing that. Like if you're interested, the person I have the podcast with, Mel, she's very interested in the brain, in modern brain research. So she just puts the character for brain in the Neijing through AI and asks it to translate. It's very interesting what she's finding and things. So I'd say it has just changed recently too.
Yeah, cool. And what I really like about your approach is actually linking it back to nature. So like going through the text archaeology and piecing together that understanding, but then using nature as kind of like a checking point. And that kind of just, I don't know, something really clicked for me when we were going through things that, like, learning Chinese medicine, we have all these terminology of nature, like within the body and everything, but it always seemed like a little bit detached and not quite synced up. And it just feels like, going through it with you really kind of made things kind of like click together that, we are treating the body as if it's nature and, like an ecosystem, and we're trying to correct that ecosystem just like we would work in a garden or whatever. And I really, really like that. And so there's a few different things that I wanted to sort of bring up on that. In acupuncture, we tend to think about acupuncture points, but going through the course with you, I learned that acupuncture points were actually only a very small part of what they were talking about in the Neijing in terms of treatment, and also a lot of what we now think of as a point was actually like a region or like naming a part of a landscape. So I just wanted you to elaborate a little bit more on like the idea of acupuncture points, where their place was in the Neijing, and a little bit more background on that.
Sure, I'd be happy to. In the development of the Neijing, we talk about the pre-disruption vision of Chinese medicine and the post-disruption. When we're talking about the disruption, we're talking about the cultural and literary crackdown in the Qin dynasty, when books and scholarship was outlawed and so forth, and much was lost. So we have this original vision of Chinese medicine. Then we have this disruption, which happened fairly early. Then we had texts and fragments and loss of knowledge and people trying to put medicine back together. And at that point, it went off on an acupuncture point trajectory, meaning that medicine was about finding new acupuncture points, defining their actions and so forth, and kind of discovering new ones and writing about them. And then that ends in TCM training when you have your acupuncture point class. And it's kind of confusing because what they did in the formation of TCM was just go back and take everyone's experience of acupuncture points and then lump them all together. So a certain point might treat seizures and nosebleeds and dysmenorrhea and hiccups, and childbirth. And you're like, well, what are all these things doing together? And like, how do they make sense? And in a protocol system, it's fine, which means you see this, you do that. Okay, that's fine when it works, but it doesn't always work, and then you don't know what to do when it doesn't work. So back before the disruption, there was another vision. And there was a vision about the cosmos and nature, and that it was formed on different patterns. And there was kind of two worlds, the worlds of invisible patterns and the world of form and politics and daily life and things like that. And the world of the pattern of forms created all the patterns in the experience world, but you don't see them. They come into the world and they form graining patterns, or patterns of motion that turn into form, and they cause patterns of nature. And those patterns of nature create your human body. So there's also this idea of standing in a river of transmission, looking back, that knowledge flows in one way. And when we honor that, we're in right relationship with the world. So the first patterns are in the cosmos, then those create the patterns of nature. Those create the human body. Those create the patterns of health and disease. The patterns of nature were what were studied by the ancients who wrote about it and created the medicine. So when we say we're kind of like nature, that's not what we're saying. We're saying you absolutely are nature, and that there are rivers in nature and there are rivers in your body, and they're called blood vessels. And they're caused by the same patterns of motion and graining patterns and so forth. And so the Neijing was all about the ecological restoration of landscapes, 100%. This is important because right now in the world, we're also on the brink of extinction, kind of. And one of the main reasons we have gotten here is the stories we tell about nature that are not true, that you're separate from nature. It's something you just go out and hike in on the weekends, but you don't really have much to do with it. That nature's something where you take the resources and then throw the garbage in the ocean, stuff like that. So underlying this is a very important story for our times about our relationship to nature. And in the clinic, when we treat patients, a lot of what we're doing is retelling their story about their body as nature. So like there's rivers here and mountains here and so forth. So originally, in terms of acupuncture points, the Neijing was all about ecological restoration, and all the 9 needles and so forth were surgical tools to restore the ecology of rivers, which were your blood vessels. There were ecological features called shui, and shui means a cavern in the earth. And that was the original name for an acupuncture point. And as I was saying before, with text archaeology, we have to validate things in nature. So where do we see that in nature? In sinkholes, or cenotes, like in Mexico. And what are the feature of those things? They're depressions in the earth where earth thins above a river, an underground river. And that's exactly what acupuncture points were back then. And there was 2 kinds, the surface caverns that were generic and the shu that have an action at a distance and so forth. And the action of all acupuncture points was to navigate or communicate with the chi of the rivers that were underneath them. So it wasn't that they weren't important, they were just very different. And most of them did not have any point action or names. They were just like, and the way when they were named, they would name the region. So they'd say fish, or Great Abyss, or Marsh at the Bend, or whatever. And they're describing there an ecological feature of the body's landscape, within which is a hole that goes down to a river. But it's the name of the region, not the hole that they're naming. So we use the shui caverns in Neijing Nature Based Medicine to access the chi of rivers, and then these other ones that have a specialized action at a distance, like the Bun Shu regions or Back Shu regions. But we're not typically trying to just find points to create point action. And then the other thing is that when we're treating a point, it doesn't mean we're just sticking a needle in a point. It means we're trying to restore ecology. And that can be done in multiple ways. So if you say, treat Daya and the Great Abyss, lung 9, it means go there to that region and assess the ecology of the river and then restore it in any way you can. And sometimes that means putting a needle near the point around it. Sometimes that means putting it upstream. Sometimes it means doing something completely different. Yeah.
Yeah, and so you also touched on this idea of rivers within the body, which kind of just made so much sense to me to understand like the channels. And there's so much misunderstanding behind our understanding of channels. Like it seems like with that emphasis of acupuncture points, it's almost like it's just like dot to dot, join the dots on the body, and these like sort of imaginary lines, but they're actually, the channels are really part of the physiology, and you can actually sort of run their courses and get a real tangible sense and feel for what's going on there. Could you go into a little bit more about some of the misunderstandings around channels? Because there's also like the primary channels, there's what we call now like divergent collateral. Could you just go into a little bit more about around that?
Sure, that's a important area. And as you said in TCM, for modern students, the channels are just the lines where you find the points that you have to find for your acupuncture test, to do acupuncture point action. And so much is lost there. And also, I would say it's virtually impossible to get back to the original vision of Chinese medicine without including this idea of blood, rivers. And that's not in TCM right now. When you look at the channels in the Neijing, they use two terms, or several terms, Jing, Lo, Mai, are some of the main ones. And they're talking about riverbeds and rivers, essentially. So if you go back to the original idea we had that there's an unseen world of motion and pattern, and they come into the world and they form things, as they congeal and slow down. And in that form, we see graining patterns, which are called Li. So just like in a tree where there's water passageways, which form as the sun's rising and falling, the water goes up and down, it creates these passageways. The passageway itself is formed on a grain, which means something related to a pattern of motion in form, right? And they tend to run vertically and horizontally, or we say axially and radially, so we can include fish in the ocean, which are kind of the other way around. But it means kind of like a loom on a thread. The thread's on a loom, that there's vertical threads and horizontal threads, and they kind of weave the world with this graining patterns. And then just like in nature, not every graining pattern in the earth carries water or is a river, but when it carries water, now we have a river bed and a river. So that's the idea. So Jing and Lo originally were these graining patterns fixed in the form of the body, which you can dissect and see, they're there. And when those graining patterns carry blood, then we add on the second character, Mai. So we talk about Jing Mai and Lo Mai, and they're the blood, that's the vascular system. And one of the surprising things is the Neijing is so sophisticated in its anatomy of the blood vessel system. It wasn't until the 16th century in the Western world that we started to understand the circulation of blood. And way back when, 200, 300 BCE, whenever they had dissected the body so carefully and were so far ahead of the game and understood how the blood flows and, even things we don't understand even yet today. Like we still think the heart is a pump, basically. But that's not really how the blood moves in the body. It doesn't explain it. And they talked about the contributions of the lung to that pattern, for example. So when we're looking at the body to do ecological restoration surgery that we do in Neijing Nature Based Medicine, we're essentially looking at how rivers flow. And a lot of the anatomical description in the Neijing is about these 12 watersheds, which are areas of the body that are defined by the flow of a main river. And you would recognize the terminology. The name of those watersheds are Upper and Lower Yangming, Taiyin, Chaoyin, etc. And that's an anatomical area defined by a river with a lot of other tissue planes in that unit, essentially. So when we're doing physical diagnosis, we're trying to understand how rivers are flowing, what's wrong with them, and then using the surgical text in the Neijing to reestablish the flow of rivers.
And there's also been a lot of areas where those channels or the channel pathways that we're taught in the textbooks today, and where they were sort of described as running in the text, have sort of like they've gone off and sort of become a little bit of askew from how they were originally described, which I found really interesting going through.
That's true. So like people will say, well, but the channels aren't where the blood vessels are, and that's because they got all moved. A lot of them got moved. And so if you read the original descriptions, there were no yin rivers on the outside of the body, on the torso. Where the kidney river channel is now, that was originally the stomach river. The lung river was originally on the inside of the arm, not the outside. There's everything got rearranged after this disruptive period, and it's only been through the text archaeology, going back and seeing, oh, these are all exactly where blood vessels are. It's very clearly, not always is there a blood vessel that we would say in Western medicine, but like most of the time, there's a very clear blood vessel system. Yeah.
And so one thing that really attracted me to your work, I was sort of at a place in practice where I felt like in the Chinese medicine industry, we're told that to really work on internal medicine, you need to use Chinese herbal medicine. There's that kind of like bias that Chinese herbal medicine is the real powerhouse when it comes to treating serious internal conditions, and acupuncture's good for pain, musculoskeletal issues, helping someone relax, that kind of thing, but it's not as powerful as herbal medicine at treating those like deeper kind of issues. And that didn't really sit right with me because, I mean, even when we are exposed to little tidbits and snippets of the classics through our training, it seemed like acupuncture was a very powerful modality and used for treating very serious illnesses. And so I just felt like there was a mismatch between, what acupuncture was in the classics and how it was practiced today. And that was part of what attracted me to your work, because you've had a career of working with people with very serious conditions and illnesses and using acupuncture predominantly as your tool of treatment. And so I just wanted to get your perspective on kind of like what's missing and what's kind of like holding back acupuncture from its full potential in the modern time.
Yeah, well, that's interesting. The Neijing is an acupuncture textbook. They do mention herbs in a handful of places, and when they do, it's going to be a pretty good formula because they went out of their way to tell you about that. But it was an ancillary technique to help things, not the main medicine. And it goes back to how they envision health and illness. So if you imagine the body as a breathing tensegrity, that's opening and closing, and it forms around a seed of light called Shen Ming. And when that's breathing and it's coherent, the body's healthy. And illness comes when something blocks that pattern. And that's called a B obstruction, particularly, which is the main indication for acupuncture. And it means something's gotten into that breathing structure, and all of a sudden it can't breathe quite right. And that changes the landscape of the body so that illnesses can develop. Now, those B obstructions get sequestered and compacted. That means the body kind of grabs them, and it usually grabs it with the connective tissue, or connective tissue is involved, just like a foreign body. And connective tissue is stronger than steel, essentially. If I'm working with someone with a large B obstruction, if I'm not paying attention, I can bend a huge needle just like it just crumples, essentially. And herbs do not touch that. So now people will argue about that and so forth, but my experience over the last 30 years is that's very specific for acupuncture. Herbs do a lot of other things, but they don't hit that thing. Needles are very specific for that. So when a person comes in with a chronic illness like cancer or whatever, it means that there has been an obstruction pattern set up in that tensegrity. It's my job to find it. I'm always interested in what I can do with the body's own system before I add other things. So I don't want to leave an obstruction in place and then try and medicate it with herbs. Like you're tired because of the block, and then we give you herbs to get your energy back, right? Instead, we always start with trying to understand from the original descriptions where the obstruction of breath is and releasing it so we can see what the body can do on its own. If we do that and then there's still an issue, then we'll step in with herbs. Is usually how it goes, but 90% of the time we don't have to. And when we're using herbs, we're focusing them more on building up deficiencies than kind of dealing with complicated medical syndromes. And usually we're doing that through herbal-based food remedies because the body takes those in better. So I would say 90% of the time we don't use the herbs, or I don't, but when I do, I'm using some kind of food prescription with herbs. And that's kind of the main idea of why I think. The other thing is acupuncture's harder to transmit because it has an esoteric aspect. So herbs are kind of straightforward, like you get a Taiyang syndrome, you make certain formula, blah, blah, blah. Here's the symptoms, here's the pulse. Acupuncture is based on light, essentially, and a lot of anatomy. A lot of anatomy. I say it's as much as learning Western surgery. It's a lot. You keep learning it over your lifetime. But at the higher levels, it has an esoteric component. And that's hard to transmit on an institutional level, in terms of institutional exams and things like that. Because what the Neijing says over and over again is you must remember this, the number one thing, the very first thing, don't forget it, it's about light. They say that over and over and over again. And that takes you into different realms. Now, this is something that would be, is kind of weird to modern people unless they've been off doing ayahuasca ceremonies and stuff. It wouldn't have been to traditional people. But it also means that that's taught slowly over time, kind of in an apprenticeship model with some secret information, secret knowledge too. We teach that too, but we don't teach it to when people first come. First, you have to learn the text, the ideas, the anatomy. Then we teach Western anatomy in advanced classes, like the class we just had with Tim McNeely, who works with fascia research, so that we're very well versed in where are we doing our surgical ecological restoration. And then past that, we start to teach the more esoteric things. So that's another reason why I think you don't see it that way in hospitals today.
Yeah, it's a very tangible hands-on medicine, and I feel like it needs that sort of hands-on guidance, which I think it's becoming harder to come by as we're sort of moving to more online stuff. Not to say like there isn't a lot of value in learning, and obviously I got so much value from learning online, but yeah, there's really that like physical part of passing on that knowledge, I think. And I look forward to when I can finally get over and do some of the in-person training, because
it's enjoyable to do. It is time consuming because it means for every student you have, at some point, a teacher is going to have to stand next to that student and watch them. And that's the thing that's really missing in Chinese medicine today, and natural medicine in general and training programs. Like in Western medicine, I had that as an intern and your medical student and stuff, someone watching me do things. And it's really not there very much in Chinese medicine, particularly in acupuncture.
Yeah.
Yeah.
Now, one thing that I just realized as we were talking along, you've sort of referred to breath and light. And I mean, we use these terminology in the course a lot, but I realize somebody listening might not have the background for that kind of terminology. Could you expand a little bit more on this concept of breath and tensegrity and light and coherence?
Sure. So working with the text archaeology, I worked on it have been working on it for 25 years. And in the beginning, I was just kind of wandering around confused like everybody else. And then there was kind of an aha moment. And I was like, oh, everything they're talking about is about patterns of motion and transformation. That was kind of one of my aha moments. Everything in here is talking about that. So then I started thinking, well, then I started to see it's actually a manual about the patterns of motion and transformation. So there's the idea of the two worlds, the worlds of form and like dinner and politics and climate change and things. And then there's a world of motion and breath and transformation that lives before it that actually regulates everything. So when we're talking about breath, we're actually saying yin and yang is the terms you'll understand from Chinese medicines. Through text archaeology, when we're examining terms, the original term meaning of yin and yang meant the expansion of motion, and yin meant the return and regeneration of motion. That means that the universe is actually a pattern of cyclical motion patterns, which we call breath, because that's what a breath looks like. So we're describing how the universe is breath, essentially. And the outgoing, expanding, organizing phase of that breath is called yang, and the returning aspect is called yin. So that's the basic nature of the universe, according to the Neijing through text archaeology. When those aspects of breath come into balance, there is a dimension of transcendent light that emerges out of its space within space-time to illuminate. And that's called Shen Ming. In nature, remember I said we have to find something in nature. Where we find that description in nature is in the formation of a star. For example, gravity pulls things together, that we call that a yin motion, and then it forces yang motion to push out, and then it creates this pressure, and then this transcendent light forms, which then organizes things into things like a solar system. So when the light turns on, the breath takes an organized shape. And the same thing happens in your body. Shen Ming illuminates from your heart. That's your central organizing place in your body, is an aspect of breath in form, essentially. Did I confuse you more, or did that help?
I mean, I understand it because we've talked about it for the last
Yeah.
2 years, but yeah, hopefully that makes sense for other people. And I really like this sort of talking about like Shen Ming and this light piece within the body, because I've been recently sort of going down rabbit holes of how important light is like for our health and our physiology. And I know Mel gets into this in some of your podcasts, and she's really into it as well. But yeah, our modern life disrupts the light signals that we're getting from our environment so much, and it's having like a much bigger impact on our health than we sort of
The
understand.
sun is our first medicine, and the sun is also the pattern that sets the patterns of nature going and aligns them. And yeah.
Yeah, yeah. Now, I wanted to talk a little bit about, or just to get like a little bit of an idea of what it might look like somebody coming in to see you with a serious kind of illness or anything. Like, what does the process look like of sort of walking through that, and then the kind of treatment process, just to give a little bit of an insight into what it might look like as a Neijing nature-based practitioner.
Sure. So it depends, depending on the severity. If someone just sprains their ankle, it's one thing, we'll just fix it. But if someone has a major issue like cancer, flies across the country to see you, I do a fairly extensive intake, and I'm really reviewing the person's life. And what I'm looking for is what we call the illness narrative, which means the story of how this all came to be, because that's what's going to help us make a plan, essentially. So it's not a protocol thing where it's, oh, you got kidney deficiency. It's like, how did this all come to be? And what I'm looking for is something we call the inflection point, which is the point at which that obstruction that went into the biotensegrity gets set up. And then it leads to what I call an illness pathway. So, and you hear it in patients' language often. They say these words, and nothing was ever the same again. So, like so and so happened, and then this happened, and then nothing was ever the same again. People say that all the time. And it's pointing us to the place where this obstruction pattern's set up. We're trying to understand what was one of the 7 causes that did it. And then usually they start off on an illness pathway, then they got surgery, then they got fibrocystic breast disease, then they got migraine headaches, then they had an accident, blah, blah, blah. And now we're 40 years later. So we're trying to get all that straight. And we also use directional thinking, that means we're trying to translate everything into phases of breath motion, which you could also call seasons or directions or wood, fire, water, whatever, metal. Those are just different ways to talk about breath. But we're going to try and translate everything into directional thinking, meaning into breath language. And then we're going to try and understand where that all lives in the tissue plane anatomy of the person and make a clinical plan, which might include like pre-surgical work, surgical work, and post-surgical work. And here I mean traditional surgery, which means the restoration of rivers using our acupuncture tools. So for example, with cancer, if the person has had chemo before we start working with them, they might have 6 months of detoxing to get it out of their system first, and then a plan to do it, to get it out, to treat the obstruction, and then a follow-up care. This was something I learned from my teacher, Dr. Cinolini, the illness narrative, she was very good at, like, the person would come in, everybody was confused, and she'd say, oh, it's obvious what happened, this happened, that happened, that happened, that happened, and here we are. And this is what needs to happen. So it's kind of a form of that, using the Neijing thinking.
Yeah. And then, and then person will go through a process with you in terms of treatment, and obviously that looks different for every person.
So we're trying to restore watersheds, and if you look at the techniques of the Neijing, hardly any of them mention acupuncture points. They're all approaches to resolve tissue-based obstructions in different locations, essentially.
That was a big aha when you started talking about acupuncture as a form of traditional surgery. That was a big aha moment for me, is that it's not just about sort of sticking a pin in a point and getting an action. It's actually about trying to change what's happening in the body in a certain area, or correct things that are going wrong in the landscape of the body.
And we use, like, if you know about the description of the 9-needle system, which was the original needle kit, it's a surgery kit. It's very clearly a surgery kit. And so the idea is you don't want to be using the same needle for everything. You want to have all these tools, of which needles are some, body work and other things are, there too. And you want to make a diagnosis first, just like in surgery. You wouldn't just walk around with your scalpel saying, what can I cut open? You'd make a decision about, is it worth doing? How would I do it? What's the approach? Then you'd reach for a tool and a technique and make a plan and execute it. Yeah. And the end result of all of our ecological restoration is the free movement of rivers, essentially. So that's the goal of every single healthcare intervention we have.
So I wanted to get your perspective on the fact that we've had a lot of schools closing down with Chinese medicine. So there seems to be like a little bit of a retraction in the industry. You've had schools closing down in the States, I know, but we've also had big schools closing down here in Australia in recent years. So what are some of the challenges that you see for our profession, and then also what are some of the opportunities to sort of grow and move into a new?
Well, first of all, we have so many possibilities because we're using so little of our potential. Like when you get back into this Neijing text, there's so much there we're not doing. So that's the good news, and we can treat complicated, life-threatening illnesses that are not being treated by Western medicine, So doing that, and it takes training like medical, like to learn anatomy and all that stuff. So you shouldn't be getting paid $45 a session for that, So there's a lot of room to grow. Our profession is failing for a variety of reasons. One is we jumped on the student loan train and everybody got rich and then burdened students with a big debt. And that was just not sustainable. That was one issue. But the other is, Chinese medicine is a transplanted plant from China. And it needs to have a root stock. So if you look at Chinese medicine as a big tree, what you learn in TCM is way out on the leaf of a branch, but you don't see the tree. And the root is the Neijing. The Neijing is the one thing that determines whether something is in the tradition of Chinese medicine. And we have the idea that Chinese medicine is a river of transmission, that it goes to the past and it's fed by a spring, or it has a root of a tree. And that is this text. And it's the root that keeps bringing regeneration and new life. And so if you don't know anything about the root and you're way out on the leaf, that leaf's going to last for a while and then it's going to die. And so, our road forward, I think, is exactly through the classics, because it's there also that we have things that, say, physical therapists don't have. They stick pins in people too, and they get results, We can't argue with that all the time. But they don't know any of this other stuff. And that's our landscape. That's our view. But in our profession, very few people know it's there. Yeah.
I remember in one of the very early lectures you referenced it's like we're a hungry caterpillar or something out on the leaf with no sort of awareness of the tree or the root, and we've got
in Chinese we say the hutu chang, which means the kind of the confused worm.
Yeah.
It's always like blind and trying to eat. And like you're out on the leaf, like way up in the air and away from the root of this tree, don't understand the tree at all. And you're just trying to eat what's in front of you like that. And of course, that's not going to lead to much.
So all about coming back to the. So thank you very much for sharing the time. I'm mindful that you're busy and you've got other things to get along with. So I just wanted to wrap up. I know you've got a new mentorship program starting very soon. So could you talk a little bit about that? And you've also got some other projects in the pipeline, including a book, which I find very exciting. So could you just give people a little bit more of an idea of if they've enjoyed what we've talked about today and want to know more, like how to learn more with you?
Sure. Yes, we have our academic year starting actually next week, but we keep enrollment open for a month after that. So anybody's welcome to come join us. We have kind of our in-depth flagship 2-year postgraduate training in text archaeology and Neijing studies, which is for people who really want to deep dive and possibly become teachers or advanced practitioners. It's a very detailed and a real training program. We take the first semester out of that, which is all about the theory and the description of the universe, and that's called the Wisdom of the Cosmos class. Someone named it that, which got us stuck. Which means if you're not a medical practitioner or you just want to kind of come in and see what it's like, you can sign up for the first semester of the postgraduate training course and get all that information. So that's all starting in a couple of weeks. And we have tuition assistance programs and things like that for people to help you. The Apricot Grove is the nonprofit we have, which oversees this nature-based medicine. And it has several very interesting projects going, and about 6 books are being written, including textbooks, but there's one for the public right now it's called Rivers from the Sky, retelling our human destiny on the patterns of nature's design. And it's this book for the public about this history of the Neijing and the descriptions of nature, trying to retell our stories about nature and reconnect to nature as a way out of the mess we're in kind of right now. So that's what I'm working on now. And then there's a lot of nonprofit projects we have going right now too. I'm very interested in storytelling because stories in a great way is what has gotten us here, and stories might be the way we can get out of it. And if you look at the Neijing, for example, it's just another story. It's words on paper, right? But when you read those words, it completely changes everything for you. So I have a particular interest in that.
Great. Thank you, Dr. Neal. Thank you very much for taking the time. And yeah, I highly encourage anyone who this chat has resonated or sparked something with to sort of follow through and check out your information. And you've also got a lot of really valuable stuff just available online through like social media, Vimeo, podcasts, articles. There's a lot out there as well.
There's a lot on our website, neijingstudies.com.
Yes, yeah. So that's the website is neijingstudies.com. Is that right? Yeah, so I encourage anyone to check that out. Yeah, again, thank you very much for taking the time today. I really appreciate it. Yeah, hopefully we can have another chat sometime soon.
Thanks. It's been a pleasure to be with you, Gavin.